Uh, Here we are going to look at femur bone. Femur is the long bone in our body and is the only bone in the thigh. Consists of the superior end or proximal end, shaft or body, and inferior end or distal end. In proximal end, you are going to find the head, neck, greater trochanter, lesser trochanter. Anteriorly between the greater trochanter and lesser trochanter, you can find intertrochanteric line. If I rotate the bone posteriorly between the greater trochanter and lesser trochanter, here I am able to show you the intertrochanteric crest. In the middle part of the intertrochanteric crest, here you are going to look at two quadratubercle. Quadratubercle will be here. Now, how we can find this femur belong to right side or left side? At the first, this circular or rounded articular facet should be superiorly and medially. And also, if you look at to the body posteriorly, you are able to find a vertical or longitudinal crest or line that we call linea spira. Another landmark that helps you to distinguish between the right and left bone is noticed to the distal end. In distal end, you are able to find the medial epicondyle, medial condyle, and lateral condyle. This medial and lateral condyle anteriorly, articular facets are going to fuse to each other and make a triangular facet for the patella. But posteriorly, this medial condyle and the lateral condyle articular facet, between these two, you can find intercondylar fossa. So this intercondylar fossa should be inferiorly and posteriorly. So this bone belongs to the right side. In the superior end, I explained about the greater trochanter. Greater trochanter, here is the apex. And here is the anterior surface, posterior surface, lateral surface, and medial surface. In medial surface, you are able to look at to a fossa. This fossa is found in medial surface of the trochanter, and you can find some of the muscle that attach to this surface. Now, in the body posteriorly, I explained for you the linea spira. Linea spira consists of two margins, medial margin, lateral margin. This medial and lateral margin inferiorly are going to far from each other and make a triangular surface that we call popliteal surface. This medial and lateral margin superiorly again are going to go far from each other. The lateral margin superiorly, you can find a tuberosity that we call the gluteal tuberosity. The gluteus maximus is going to attach to gluteal tuberosity. And here, if you continue the intertrochanteric line medially, here you are able to look at to a spiral line. Inferiorly, here is the medial condyle, lateral condyle, patellar surface, and here is the intercondylar fossa. Look at to the lateral and medial margin of the linea spira. The lateral margin inferiorly is going to be continued to lateral epicondyle and called the lateral supracondylar line. And here the medial margin is going to continue to medial supracondylar line of crest, and it is going to show you another tubercle that we call adductor tubercle. Adductor tubercle is visible here. Here is the medial epicondyle. Now about the tibia. As you know, the tibia again is a long bone, proximal or superior end, body or shaft, and inferior end. The superior end is larger compared to the inferior end. In superior end, we can find two articular facets, medial articular facet and lateral articular facet. Medial condyle and lateral condyle. Medial condyle of the femur is going to articulate with medial articular facet of the tibia, and the lateral condyle of the femur is going to articulate the lateral articular facet of the tibia. Between these two, here is the eminence that we call the tibial eminence. Here we call the lateral intercondylar tubercle, and it is the medial intercondylar tubercle. Anterior to this tibial eminence, you can find a space. This space is a site for attachment of anterior cruciate ligament. And posterior to intercondylar eminence, you can find a space. The posterior cruciate ligament is going to attach here. You should know the medial condyle of the tibia. Posteriorly, here we have a groove that the tendon of semimembranous is passing here. And here you are going to look at tibial tuberosity. Superior part of tibial tuberosity is for site for attachment of ligamentum patellae, and inferior part is subcutaneous. Look at the body consists of three borders: anterior border, and the medial border, and the lateral border or interosseous border. For the tibia, the interosseous border, the another name is lateral border. And three surfaces: medial surface, lateral surface, and posterior surface. In posterior surface, you can find an oblique line that we call the soleus line. If you look at the soleus line with this longitudinal or vertical crest, divide to two small surfaces. And inferiorly, you are going to look at the distal end of the tibia. This is the medial malleolus. Medial malleolus has the medial surface, lateral surface. In lateral surface of medial malleolus, a comma-shaped articular facet is visible. It is going to articulate with the medial surface of the talus. And here the inferior surface of the distal end is the articular facet that it is going to articulate with the superior surface of the body of talus. Medial malleolus is larger than the lateral malleolus, and it is a process that belongs to inferior or distal end of the tibia. But the distal end or inferior end of the fibula completely make the lateral malleolus. And also, if you look at posteriorly, here you are going to look at nutritional foramen. Nutritional foramen is visible in posterior surface of the tibia. And if you look at superiorly, I forget to explain about the lateral condyle. In the laterally and inferiorly, we can find the articular facet. This articular facet is a facet that it is going to articulate with the superior or proximal end of the fibula and make the superior tibiofibular joint.